Thank you so much. Again, I'm Katie Galbraith. I'm the president of Duke Regional Hospital, and on behalf of our 1,600 team members at Duke Regional and 15,000 team members across Duke University Health System, I bring you warm greetings from North Carolina. So, very, very pleased to be here with you today and very honored to have this opportunity to share just a little bit about our journey in the area of diversity and inclusion. To share a little bit of the context of the work that we've done as a system around diversity really started back when we were in our infancy as a system, back in 2001. Ben Reese, who's our Vice President for Institutional Equity for Duke University and Duke Health System, suggested back then that we develop and establish a diversity leadership group that would be comprised of both senior leaders and frontline staff. And so in 2002, Duke University Hospital did just that. And by 2005, we had diversity leadership groups in each of our hospitals, as well as our billing organization, the Patient Revenue Management Organization, or PRMO as we refer to it. We also, at that point, established a DLG for the system. And more recently, in the last 2 years, we've established what we call an executive DLG. And that is co-led by Ben Reese and our Executive Vice President, Dr. Bill Fulkerson, and it includes the 3 hospital presidents as well as the head, again, of the PRMO. You can see here just our org structure for those DLGs. So now let me talk to you about our journey at Duke Regional Hospital. As I said, we had a DLG back around 2005. It was established. We called it our Diversity Committee. And I would say, and this is somewhat from outside looking in or looking back, if you will, because I was in a very different role back in 2005, but really never fully got off the ground. Not quite as much focus as we probably needed it to have. And so in 2008, we were very, very fortunate to have a wonderful leader join us as our president, Kerry Watson. Some of you may know Kerry. He's actually now with the Partners System up in Boston. But Kerry came into really a new executive team. I had only been on the executive team for a few months when Kerry started. Rich Walsh was our Chief Human Resources Officer, and he had been with the team for a couple of years, and otherwise it was complete turnover in that executive team. So we had a brand new team that Kerry was forming, and a renewed commitment to really building a culture of inclusion and respect in our organization. And we focused on 4, I think, really key areas. First of all, defining diversity, executive diversity dialogues, and I'll talk a little bit about that in a minute. We did a lot of diversity training, so all of our managers, all of our employees go through diversity training. And we do that, our aim is to do that within the first 90 days of hire, that folks go through that training. And then our diversity leadership group, or teams, if you will. Defining diversity, I think, was really important for us, and it was a turning point for us because we really define diversity very broadly. It's about both our differences and our similarities, and our life experiences and how those experiences bring value to us as an organization, bring value to the team, and how we respect people and value people for what they bring to the table. And that was, I think prior to that, it had been a little bit more of a narrow, or there was a perception anyway, that it was a narrow view of diversity, really either race diversity or gender. And so that broader view, I think, was really important for us in terms of having everyone feel like they were valued for who we are as individuals and what we bring to the team and to our patients. You know, I said my perspective is that we had floundered a little bit with our previous diversity work. It's not that we didn't have some really passionate people on the team, we did. But I think where we lacked that passion and that engagement was at the executive level. This was something that we were being told we needed to do versus something that we recognized we had to do because of the imperative for better outcomes for our patients. And so as we started to relook at this, it had to start with leadership. the work we did had to start with our executive team. And we had to look deep inside at what we wanted our culture to become as an organization. And so we actually did a really deep dive on our own, as executive leaders, on our own learning around diversity. We brought in someone, Judy Seidenstein from the health system, who came over and worked with us. And initially, we worked for about 2 years on this learning platform or learning foundation. And it's ongoing work, I would say, but really intensely for 2 years. Initially, about every 2 weeks. And we would get together and we would read Harvard Business Review articles or other articles. We did the implicit bias test, the IAT, through Harvard to understand our own implicit bias, which is not a comfortable thing. I don't know how many of you have taken the IAT. Few, yeah. That was eye-opening for me. You think you're open-minded, and the fact of the matter is that as human beings, we all have implicit biases based on our background, our unique perspectives. And so these were not always comfortable dialogues, because talking about difficult issues is not always comfortable. But it really brought us together as a team. And so not only did it build our foundational learning from a diversity and inclusion perspective, it built our executive team. And that was a tremendous benefit, an executive team that is largely still in place today. Great experience there. We did this after hours, typically over drinks, because when you're talking about uncomfortable subjects, it's easier to have an adult beverage in your hand. But it really got in depth in our own thinking and putting ourselves in, one of the exercises we did was putting ourselves in a place that we normally wouldn't be in. So, really making sure that we were living our value of diversity ourselves. And that's really where our work started. We also, again, had that one diversity leadership group, and one of the many things Carrie taught me is, a group of 20 or so people is not going to be a very effective group, most likely. You really need 8 to 12 people on a team, to have an effective team. And so we actually divided our team into 2 groups, one focused on employee diversity, which I served on, and one focused on patient diversity. And these, again, made up of senior leaders, managers, frontline staff, but very important point here, we checked our titles at the door. And I will tell you that has become our culture for all of our meetings. It's checking that title at the door. We value everyone's input in our organization, and that's really important. One of the other things that, just sort of as a side piece on this, one of the other things we did sort of outside of our diversity team at the same time is I worked as Vice President of Operations with most of our support services areas, and really helping to bring them up to feel valued for what they bring to the table. And so, our housekeepers are not in the business of just cleaning floors. Our housekeepers are in the business of saving lives. And I remind them of that every time I meet with them. And I remind other people of that when I meet with them, because we need to elevate all of our team members for who they are and the critical job that they play in caring for our patients. Everyone in our hospital has an ultimate responsibility of helping us care for our patients. And so that was important. So anyway, we checked our titles at the door, and the teams focused on 2 to 3 priorities each year. And at least one of those had to be data-driven. We're a data-driven organization. So the employee diversity group, for example, would drill down, and we still do drill down on our work culture surveys on an annual basis, and we look at those survey scores by demographics. And so I know that our Hispanic employees, for example, score us higher than our non-Hispanic employees. One of the things that we learned through this process is that our third shift and weekend shift employees scored us much lower than our traditional day shift, first shift employees. And so one of the things that we did there is focused on, we went out, we met with them, we tried to understand some of what was driving that. One of the things that was driving it was actually fairly simple, although there was a price tag to it, but simple to fix. And that was, we didn't have cafeteria service overnight. And there aren't that many restaurants around us, and certainly not open overnight. And so that was a real dissatisfier. They didn't feel valued as employees. And so we've made a concerted effort. First of all, we've opened overnight service, our night owl service. And then we've made a concerted effort to make sure that we're rounding on night shift and on weekends. I go in on weekends. I go in at night. We have expanded our holiday buffet, which used to be during the week. We make sure that anytime we do employee events, we have options for weekend and night shift employees. The other thing that we did is looked at employee development. And so, again, looking at the data, we have a wonderful benefit, career enhancement benefit, that our board provides for us. Up to $500 per employee per year for career development courses, coming to a conference like this, for example, to pay that conference fee. Overwhelmingly, almost all of the people who took advantage of that were nurses. Why was that? Well, it's because you had to pay up front and then you got reimbursed on the back end. And if you're a galley tech in our food service department and you're making $11 an hour, it's pretty hard to pay up front for a $200, $300, $400 class, right? So we changed that. We worked with our HR department. HR now pays up front, and you just have to show a certificate of completion of the course. And since then, we've had employees from environmental services, food services, go through and become not only CNAs, but then go back and take advantage of the Duke University Health System tuition benefit to go back to nursing school. And so this is employee development. And the focus of this conference is on leadership development, but you have to start with your employees because they're our future leaders. So a lot of really good work there. And those are just a couple of examples, a lot of other things that we've done. The other thing that we looked at and continue to look at regularly is succession planning and recruitment. And so we have a succession planning process across the health system at an executive level where we look at critical positions and critical talent and high potential individuals. And we identify those high potential individuals and really start to create development plans around them. How are we going to develop them over time? And then how do we align them, align that talent that we've identified with vacant positions? And one of the things as we've gone through this process that we recognized was that we had a need beyond just our traditional administrative fellowship program. So we have a very well-established administrative fellowship program at Duke. Very, very well respected. A lot of those fellows have gone on to great things, both within Duke and outside of Duke. But if you're, and I can use myself as an example, I went back to get my MBA at 35. I had a 10-month-old and a 2-year-old. There was no way when I came out of that MBA program that I could take the kind of pay cut that I would have needed to take to go into an administrative fellowship for 2 years. I just couldn't do it. And so who are our high potential individuals out there? And we look at this really through a diversity lens. We look for a diverse group of individuals because a real focus on this is developing particularly minorities and women for leadership positions in our organization. And we're looking for those from within the organization. And this is the second round. We just started the second round of this fellowship in July. It's an 18-month program. It's a very rigorous interview process, and then it's a rigorous program. And you get exposure to the entire organization across all of Duke Medicine. And you get to learn, you have an executive sponsor, not your CEO, not your direct boss, but an executive sponsor who really works with you and meets with you on a regular basis. I meet with our executive fellow on a monthly basis. And I can tell you our executive fellow now is just thrilled with the program because she is learning so much. And this will help her be a better leader, if not in our hospital, somewhere else in the health system. The one caveat to this that I will mention, you work 75%, I think the first year we did this, it was 50% in your fellowship, 50% work. We've changed it. You now stay 75% in your current job, 25% of your time is dedicated to the fellowship. You keep your current salary, which is great. One of the things that we have noticed with this is we had a pharmacist, for example, who went through the fellowship program about 2 years ago. And he's had trouble making that leap to another position post-fellowship. And part of that is because pharmacists are very well paid to begin with. And so unless he can move into a pharmacy management position, and there aren't that many of those in our system, he needs to move to another management position. If he moves to a health center administrator position, for example, it's a significant cut in pay. So you have to be upfront. What we've learned is we have to be upfront with setting those expectations and talking about those expectations with our employees as they're going into the program and applying for the program. So let's talk a little bit about our progress. And you can see here, we do a work culture survey or engagement survey through Press Ganey, used to be Moorhead, now purchased by Press Ganey, every year. And we've had tremendous improvement over the last 6 years or so in our engagement, particularly in the areas of diversity. So my entity values employees from different backgrounds, and you can see here the improvement over time in those scores and how our employees feel engaged. You can also see on the workforce commitment score. The workforce commitment score is a composite score of 6 questions, really about how our employees feel engaged, how committed they are to staying with our organization, really important marker of employee engagement. And then also nice to see that our employee turnover has gone. I will also tell you, we focused on employee development. That is a real strength for us in our organization. And so, again, we've seen an increase year over year in our employee development. My organization provides career development opportunities for us year over year, significant improvement, and we are statistically significantly ahead of others in the system and the national benchmark for that. We've also, the patient diversity group has done a lot of work, among other things, on really educating our organization around the care needs of our LGBT community. We've been recognized as a leader in the healthcare for the LGBT community for the last 3 years, and we're very proud of that. And in fact, we actually have a new plastic surgeon who's joined us in the last couple of months who does gender-affirming surgeries. And there are not many plastic surgeons who do gender-affirming surgeries across the country. But there are 2 reasons she chose our hospital. One, the Duke name, so that rebranding that we did a year ago was beneficial to us. And 2, because of this certainly weighed into her decision, the fact that we've been recognized for our care of the LGBT community. And then we've had improved diversity in our leadership ranks. And we look at that and we measure that on a regular basis. We are home in the health system to the first African-American president, Carrie Watson, 6 years ago, and I became the first permanent female president back in May. So really, I have personally benefited from the leadership development that we've done as an organization over time. I'm very proud of the fact that we've got 50% women on our executive team, 25% minority, still not quite reflecting our community, but close, making progress, improved over where we've been in the past. In nursing leadership, we do very well. 43% of our nurse managers are minorities, and 14% are male. So love to see that improve as well. Again, we look at different aspects of diversity. We still have a real opportunity around non-nursing leadership roles, and I would say we have a real opportunity in the non-leadership roles in the skilled crafts. That's an area where we have trouble even finding a diverse pool of talent, and we always look for a diverse pool. And then when I think of sort of how this all fits together, I think of Project Search. And I don't know how many of you are familiar with Project Search or have this in your hospitals, but we were presented with this opportunity about 4 years ago. And group from the community came to us and asked us as a health system if we would consider participating with Project Search. Project Search was started at Cincinnati Children's Hospital. It is a program for students with developmental disabilities. And so in our community, it's a partnership with Durham Public Schools, some other community organizations, and our health system. And I quickly raised my hand and said, I'd like to have us start this at Duke Regional Hospital. I thought it would be a very nurturing environment for this. What I didn't recognize fully was just how valuable this would be for our work culture, but it has been tremendously valuable for our work culture. This is our last year's graduating class. We've had 3 graduating classes now, so 7 to 9 students a year. They spend an entire year with us. They have a classroom in the hospital, and then they go out to work sites in the hospital and learn actual job skills. They come into us in August, most of them very shy, not making eye contact. By the end of the year in May at our employee event during Employee Appreciation Week, they're out there, the first ones out there doing the hula hoop contest or the dance contest, and they feel really valued for who they are and for how they're helping us take care of patients. It is a tremendous transformation. And what I'm most proud of is a week later, when they're having their graduation, which we hold in our auditorium, and they have all their teachers and their family, their loved ones there, and they are surrounded by our team. So our auditorium holds about 200 people, and we generally come close to filling that. And much of the group there is our employees who are there to cheer them on, and there's typically not a dry eye in the house because we are so proud of what they've accomplished. And I think this is a great reflection on the work that we've done around building a culture of inclusion and respect, because I don't think this would have been anywhere near as successful in our organization if we didn't have that foundation of really understanding why we need to have that culture and really building that culture. So it's really a proud day for us when we can talk about our Project Search students.